the Family Partnerships Coordinator for the Maternal Child Health Division. We're really, really thrilled to be partnering with you all and with Vermont Family Network to get this really important information out to you. I wanted to let you know a little bit about how this meeting is going to go. We are going to, pretty soon I'm going to turn it over to Adam Poulin, and he's going to discuss the content of the policy changes for children's personal care services. Adam is then going to answer the previously submitted questions that some folks submitted on a Facebook group, some folks submitted to Jamie, and then we're going to ask anybody who has additional questions to submit them via the Zoom group chat. I will then read the question as it appears to Adam, and Adam will do his best to answer. I also wanted to remind folks that we do have a hard stop at about 10:55, maybe 10:57. So we'll probably take the last question around like 10:52. Again, Adam has some very comprehensive content to share, so I'm optimistic that your questions will get answered. Again, as Jamie said, we are recording this so that folks have an opportunity to watch and to learn if they haven't had an opportunity to join this call. So again, please refrain from sharing any private information or personally protected health information. So with that, I'm going to turn it over to Adam.
Thank you, Charlotte. And thank you, VFN and Jamie, for hosting. Thank you all for participating and bearing with our kind of like trial effort here with Zoom. Just so people are clear, Jamie has got the PowerPoint all set up, so I'm going to be awkwardly typing to her when I want her to advance the slides. And so, Jamie, you can keep moving forward here if that's okay.
Adam, sorry.
Yeah.
Just tell me, just say next slide, please. And
I'll say next slide.
I can't see the chat. Yeah.
Great. Okay. So this is a little overview that Charlotte kind of spoke to here. You can go ahead now, Jamie. My goal will be to cover the content in this PowerPoint pretty quickly, so that we do have time and space for people's questions in real time. Okay. And we really want to collect any questions that we can't answer, to your satisfaction in this meeting, and follow up as soon as possible with more clear answers and things like that. You can go ahead, Jamie. Thanks. So I'm going to jump right into it. Again, thank you for rolling with this. I've done a fair amount of Skype meetings and using PowerPoint, but Zoom and having the video function is a little new to me. So I'm regretting the laundry basket in the background. So, okay, this is an overview of kind of where we're starting from here, and an overview of the change that the state of Vermont has requested on a temporary basis from CMS. So our starting point is that children who receive personal care services need extra support with their daily self-care. And we know that during the COVID-19 pandemic, families may not be able to access the extra care that their children require from an outside provider due to added risks of exposure to the virus, both to their provider and to their family members. So the Agency of Human Services requested a waiver from the Centers for Medicare and Medicaid, CMS, to allow parents and family members of eligible children to receive payment for the extra care that they're providing during this time. So that's a very significant change to business as usual for personal care, where the service is really intended to provide extra support to caregivers and families. And typically parents and step-parents and primary caregivers are precluded from getting paid for the care that they're providing. So this is a very significant, and it's a temporary change. And I'm looking at the last portion here on this slide. This will be retroactive to March 15th. So that was the Sunday before schools were ordered closed and the stay-at-home orders were strengthened. We are able to have this in place for the duration of the public health emergency as it's defined by the federal government. So we're going to be trying to stay updated with how that timeline will unfold as well. And I'll speak a little bit more about, all the process for parents to access these funds in terms of what that'll look like going back retroactive. I'm going to do my best not to talk too fast too. It's like a fine balance of coffee in the morning where I start getting motor mouthed or just start stumbling. So Jamie, you can go ahead. Thanks. Okay, so the model that we're working on during this temporary change is very different than the typical employer-employee framework that is in place with ERIS solutions that families typically use to access support. So parents will fill out an invoice that ERIS has created and receive a tax-free payment on a bi-weekly basis after these forms are completed and submitted. The payments are made at the base Medicaid rate of $13.74 an hour, and it'll be based on the number of hours per week a child has previously been found eligible for. So you can go ahead, Jamie. Actually, I think I have an example in the next slide here. ERIS has the ERIS form is very straightforward, collects some basic information about the person who will be receiving payment, including like name, address, relationship to the child, the date range, and the number of hours provided, only up to the child's weekly allocation. We have these invoices ready to go. They're already on the ERIS website, and they can be downloaded and completed and submitted as early as today. We'll talk a little bit more about that process in a few slides. ERIS will be mailing blank copies of these invoices too with the next round of the spending reports that they send out to employers. And in some cases, a family may not be connected with ERIS, like we might have authorized personal care for a child, but for whatever reason, the family hasn't enrolled as an employer. And so there's just one extra form that a family will need to fill out in that case. And it's called the parent-child relationship form. So that is also available on the ERIS website. So I'm looking at the last portion here on the bottom. Completed forms can be mailed, faxed, or scanned and emailed as a PDF to ERIS. It's all the typical arrangements that are in place with ERIS right now. I'll go over some details with that in the coming slides too. Jamie, can you move forward? Okay. So, again, I wanted to kind of focus more on the process here, not the premise, but in the question and answer time, we can get further into that. I realize I'm moving through these very quickly. So payments will follow the typical children's personal care pay cycle. So that means that any forms completed and submitted by noon this upcoming Monday on the 13th, those will be paid out in the typical check run next Friday. And then the next pay cycle, 2 weeks after that, completed forms submitted by the noon on Monday, the 27th of April, will be paid in the check run on May 1st. May 1st feels like a ways away. So I want to make sure people are clear on what they can do in the short term. The last little phrase down here talks about, we explored whether ERIS would be capable of issuing off-cycle checks, knowing that time is of the essence here. Families have been waiting. And so ERIS, like every other entity, they have some changes to their staffing patterns related to COVID as well. And so for forms that, sorry, I'm seeing some of the questions pop up here. That's wonderfully distracting, but I'm glad we're capturing all those. ERIS will do their best to process forms submitted off-cycle, depending on their staffing availability and after they've met their contractual obligations for other payrolls that they run. And in order to be fair, they will process payments off-cycle in the April 24th check run if they're able to process all the invoices submitted at that time, if that makes sense. All right, Jamie, you can go forward. Okay, so some things to keep in mind. These payments will be made out of a child's current allocation of personal care services. Parents are not obligated to be paid for the entirety of a child's weekly allocation. Other personal care attendants can be used if that works for your family. We'll just need to be aware of remaining funds in an allocation period. And then this last piece here, I would certainly really want to drive this home, and we wanted to get this information out as quickly as possible in a relatively short turnaround time from when CMS gave state approval to do this to now. It's been a bit of a sprint, but we know that this will generate more questions. We're going to take the next 45 minutes and try and answer as many questions as you have. I can go back in slides. We can, bring up a copy of the ERIS invoice form that Jamie has now if people are interested in looking at that right now. But I'll just really want people to hear this loud and clear that we're still answering phones, we're still responsive to email, questions about your individual family circumstances or how this change will really work for you. Like we wanna discuss. So Jamie, go ahead. Okay. So this first wave of questions and answers is going to focus on some of the previously submitted questions that I believe Tammy made available to us. My one caveat here will be that a lot of those questions pertains to services covered through Dale. And those of you that were already logged into the meeting a little earlier might have saw Tammy's comment that Dale is pulling together their response measures kind of as we speak right now. And so I think they're hoping to be able to give out some guidance this afternoon, and if not, first thing next week. So questions that were previously submitted that really pertains to like home and community-based waiver services that we can't answer today, we're going to capture them and relay them to our colleagues at Dale. And same thing with anything that you all bring up right now. Betty is going to be capturing and documenting questions that we feel that we can't really answer. So these are some of the previously submitted questions. So first one, can both/multiple parents be paid as employees? And so first thing to keep in mind, these payments are not a form of employment. So, we felt like this, we wanted to preserve like the typical employer-employee relationships that families already have with their staff. And then a whole host of like tax and labor laws kick in if you're using an employment model. So this is very, very distinct from that, which I think is reflective of how, severe the circumstances are right now and the fact that this is a significant change to business as usual. So yes, week to week, a different caregiver, a different parent could be the one to receive payment for the extra care that they're providing. It'll just be important to make sure that, forms are filled out accurately, and that if the total hours submitted over a 2-week period are more than a child's weekly allocation in sum total, then ERIS will bump payments down to what has previously been authorized and previously been determined medically necessary. So the next question, will there be a background check? No, there will not. ERIS is obligated still to do a quick screen against the Office of Inspector General's exclusion list, which I'll say in all the prepping for this call, I haven't dug too far into what that entails, but my sense is that that's a kind of a quick formality, but there are not the typical background checks that ERIS would do when you hire an employee. So a lot of these changes really reflect the fact that this is not an employer-employee way of moving these funds out to families right now. Jamie, go ahead. So the question was, how many hours at a time can we be paid? So checks will be cut bi-weekly following the typical ERIS pay cycle. And an invoice can contain a total of a child's weekly allocation over the course of 2 weeks. So the example that I used here, going back to Sunday, March 15th, is if a child has been found eligible previously for 5 hours a week, a 2-week invoice could include up to 10 total hours. A family is not obligated to try and access the full 5 hours during that time. Again, if you have another PCA that you're paying, that's fine. Families might choose to be reimbursed for fewer than those total hours per week. The next question around overtime eligibility, again, follows suit with the fact that this is not employment. So FLSA rules do not apply in this case. All right, go ahead with the slide there, Jamie. I'm seeing lots of great questions already. So the question was, what about those of us in the midst of a renewal? So Children's Personal Care Services, one of the first COVID response measures we took was to suspend the reapplication process and grant 6-month allocations at a child's previously determined level. So we had sent out reassessment request letters already for April, May, and June, and families who received those letters should have since received a corrected letter explaining that we're suspending the need for reapplication at this time. That said, new applications and reapplications can still be reviewed. We've made some modifications to our staffing patterns, but our clinicians are still reviewing applications, especially for new applicants, new kiddos coming in. So the short answer to that question, sorry, is there shouldn't be a need for renewal at this time. And if that's not reflected in the letters you've gotten from us, please reach out to us and we'll correct that and sort that out. The next question, more of a statement. We need a clear list of forms and instructions. I 100% agree. Again, I'm conscious that I'm talking rather quickly here. So we have a guidance document that'll be up on our website later today that will be linked to the ARIS website. It will go out in a mailer through ARIS as well. And the guidance document includes links to basically the main form that families will need to use to fill out. That form is already on the ARIS website. Again, ARIS's customer service staff will be available to walk families through that form if you have questions, and the same thing with Children's Personal Care Services staff. And just sometimes when these comments pop up, I can't see the screen. Just a sec. Okay. Okay, Jamie, go ahead, please. All right. So I feel like I just raced through this PowerPoint. That might be reflective of a little bit of nerves on this Friday morning here, but I think there are probably a lot of really good substantive questions right now that I can respond to. So, Jamie?
Yes.
Or rather, Charlotte. So I trust that these questions are being captured.
They are.
Yeah. Can I just start at the top? Can I scroll up and go down through them?
I was just going to say, Adam, if it's easier for you, I can start from the top and read them out loud so folks can hear and that their questions are being answered, and then you don't have to multitask. So
yeah, please.
If the first question we received was, if you are enrolled as an employer, is it just the single form you have to fill out versus the employee packet?
Correct. If you're the one who will be paid, you're the current employer, all you need to do is fill out the new invoice form.
All right. The second question is, how and who will be explaining this to families who use English not as their primary language?
Great. So there is a communications specialist, I want to say at VDH, that we work with, that we're going to create some different translatable versions of this. And that's a great thing for us to follow up on. But we do have somebody at VDH who will be helping with that. Now, as far as explaining this, another thing we're going to do is we communicate a lot with the staff at the designated agencies who have been trained to administer personal care applications and screenings. And so we're going to do another big email blast to that group as well, because they're in a good place to assist the families connected with DAs. Otherwise, I think, we are always available with a phone interpreter to walk families through this as well. So I didn't really go into some of the communications plan around this. in the presentation, but that is not lost on us. And we intend to engage staff at DAs, the CSHN, social workers, and to make things translatable and accessible on our website, and via snail mail too, just because not everyone's going to be accessing it on the website. And one other thought that I'll just add here is, we know time is of the essence. Like I said, from CMS approval to now, it's been a relatively short window of a lot of work to sort out details. Not all the details are sorted out. If there are different versions of this, we'll communicate them as best we can. And the change is retroactive to March 15th. So there's likely going to be waves of payments, I expect, going out. And some of the payments, if a family, for some unfortunate reason, isn't notified or doesn't get the details of this for another week or something like that, like they're still able to come back and get reimbursed for the extra care that they've been providing during the time.
That's a fabulous point to reinforce, Adam. Thank you. We've got a slew of questions, so I'm going to
keep going.
If a child's funds is based on funds, not hours, where employer chooses how much to pay employee, are they also bound to the $13.74 per hour, or can we use the PCA's normal pay?
I think the way I want to answer this is to think of it as, is to really stress that this approach is not based upon employment. So that allows us to get payments to single parent households, so that there's no need for the employer-employee to be the same person. And it also preserves your typical employer-employee relationship. So if you're using one of your ongoing PCAs as the employer, you still have that flexibility around setting the wage and administering funds within week to week with some fluctuations. Like, we understand families do that within like their typical 6-month allocations. So our intent is for there to be no change to how families are using their PCAs. Like if you've already kind of sorted out the considerations around risk for exposure and whatnot with people coming in and out of your house, things like that. I don't know if that answers.
Now we have another question. What about families who have not been able to find PCAs to fill positions in the past? Will they be able to collect payment now?
So going back to March 15th, parents can be paid week to week based upon their child's weekly allocation.
Okay.
Go ahead.
No, I mean,
I think that question kind of, I don't know, when I hear that, I feel like that implies like how retroactive can we make this? So going back to March 15th, yes, but prior to that, no. And at some point, we know that the federal government will declare the public health emergency to be over. We're not looking at that, any type of timeline for that right now. So this is in place retroactive to March 15th for the time being.
Thank you. Is there a mechanism in place for our caregivers who are not able to come to the home to obtain financial support?
So, broken record here, but again, the fact that the typical model for paying a personal care attendant is based on employment, they are eligible for unemployment insurance. They pay into that system as part of their wages that they earn for their work. So we can't guarantee how claims will be handled right now, but they are eligible to apply for unemployment insurance at this time, yeah.
I think you might have already answered this, but I'm going to ask it again because I'm not positive. Is this taxable income to parents?
It is not. It is not taxable. It is not considered income.
Okay. This is a long one, so bear with me.
Sure.
If in our current budget period, we have underutilized funds so far in this period to save them for later, we will not be able to use our budgeted funds before they expired if we are only allowed to invoice ARIS for our weekly allocation.
Okay.
I received a reassessment request, did the reassessment, received a letter starting a new allocation, and then received a letter stating that I did not need a reassessment. Does
Yeah.
my new allocation still apply?
So, so two-parter, 2.5-parter there. The second, I'll go to the second part first. So the, I would ask that parent or family to reach out to us individually, and I'll just go into the Medicaid portal and
Yep.
ensure that full extension or that, you know, additional authorization period is in place. That was our intention. We were turning around pretty quickly and issuing corrected letters. So I'm glad you got the corrected letter, but I get that it's not yet crystal clear. So I can verify that with you on the phone or via email, you know, later today if you'd like. The first part of that question around, you know, when you're acting as the employer and you're hiring employees, you have some leeway in terms of how you administer your funds. What I'll say is that the eligibility process that we typically use is not changing at this time. It's still based upon medical necessity, and so the you know, banking and preserving kind of unused funds, which we know strategically is like a great thing that families typically do, is fine for the employees that you will be using later on. It is not transferable to this model of paying parents for the extra care that they're providing based upon that weekly determination of personal care hours that was determined in the last assessment period.
Thank you.
Yeah.
Next question. For a parent who is not currently employed, would they have to file taxes with this and or claim it on fuel, reach up food stamps, etc.?
So the first part for income, no, this is not considered taxable income. There are other support models in the system of care that are based around like a foster care kind of approach, and that's not taxable income. And this is similar to that in a sense. The question around other assistance and eligibility, I don't want to give out bad information there, so that's a good one for us to collect and do some digging. I know that question was raised by one of the CSHN social workers in the last day, and so we want to look into that further. We don't want to give anyone bad information or jeopardize those benefits. I don't believe that will be the case, but again, I wouldn't want the definitive answer now to be don't worry about it, and then for that to come back around. So that's a good one for us to collect and follow up on.
All right. And I just want to share some shout outs. Great news for families. Adam, you're doing great. Thank you, Adam and team, for all this great info. And how will this information be dispersed? We already covered that. It's going to be retroactive till March 15th. And it's going to, yeah. Do you know if I would lose my unemployment benefits?
It should not affect unemployment status because it's not taxable income that you need to report.
Great. Is there an age limit for the child? If a parent is caring for their child who is an adult, the parent is the guardian and normally has a home budget through ERIS funded by a Medicaid waiver.
I think that is a question for our Dale colleagues. If I follow, I think that individual is referring to home and community-based waiver services. So I'm not sure that I can answer it. But we'll collect it and we'll make sure that it gets to our Dale folks.
Yes, there's been so much information and so many questions, and Adam stated this, and I want to reiterate, we have Betty, the incredible Betty Morse, collecting all of these questions for Dale and the questions that we don't quite have answers yet. Betty is here, and she's collecting them to make sure that we do get back and answer them. Can a sibling under 16 qualify for this?
So we cannot allow individuals under the age of 16, but individuals 16 and up are eligible for consideration. That would be in the typical like employer-employee model. And so parents right now, I mean, that's not necessarily changed to our business as usual there, where with a quick variance request, we can process employees down to the age of 16. Yeah.
I believe that you already covered this, but I'm going to ask it just to make sure.
Mhm.
A PCA is allocated 4 hours a day, but without school, she's supporting more like 8 hours. Will
Mhm.
my son's allocation be expanded until school resumes in September?
So I don't know that I answered that actually. So one thing that the short answer is that it won't. Our typical process doesn't take school hours into consideration either way. So when our clinicians are reviewing eligibility, we don't say, oh, a child has X amount of school hours and then subtract that from what the allocation of personal care would be. So the flip side of that, these circumstances, however real and impactful they are, doesn't change the underlying eligibility determination process. So I'll pause there. We can discuss that further too. The reapplication process is the opportunity where if there's a change to a child's underlying need for personal care services, then we will review the new materials and issue a new notice of decision. That's where if there's a change and a family feels like their child's underlying need for personal care is increased, unrelated to the impact of not having school, that's where we could consider changes to a weekly allocation.
Great. I want to just give you a gauge, Adam. We have about 29 more questions to get through.
Great.
If these payments are not a form of employment, are we eligible if we are drawing unemployment? If so, will it affect our unemployment?
I would encourage folks to speak to their benefits counselor to really iron that out. But because this is it's kind of modeled on a difficulty of care payment, again, that I think is reflected in a foster care system in a lot of ways. So it is not subject to tax and doesn't need to be reported as income. So I don't know if the unemployment eligibility process looks at non-taxable forms of income as well. That might be something that we can follow up on, as I would say. Let's keep moving to the questions. But
yep.
The legal and policy review that led up to this approach, ironed out some of those questions. But again, I wouldn't want to steer anyone wrong.
We have more tax questions. As you are using invoicing, will the state send us 1099s, making it eventually taxable?
I do not believe that is the case. In our conversations with ERIS, that did not come up. They're using ERIS as a method of paying vendors who do get a 1099 for the services they provide that ERIS pays out. But because this is, again, considered more like a difficulty of care payment, and I think that there are some exclusions when personal care is provided in the family setting, that it doesn't have to be considered employment, that really wouldn't apply here. But again, I get that there's like this cluster of tax and other benefits questions, and people really want to be clear about that. So I'm going to engage, our legal and policy folks so that I'm not kind of giving you incomplete answers.
Okay, I'm going to skip ahead because there is somebody who is really feeling like their question wasn't answered.
Okay.
Sorry, Adam. Kristen and I had a question that wasn't answered. Some children's PCA is based on funds, not hours, so those families get to choose how much to pay their PCA. Minimum wage through X dollars an hour. Are we bound to pay the parent $13.74, or can we choose the pay?
So I'm a little little confused by some of the question there. And so what I'll say is that families whose children access home and community-based waiver services and who have what's called a unified services plan, where children's personal care services are used to fund the HCBS waiver, it's those personal care funds are really a part of the DALE system. And so we'll need to see what their response measures are. That's totally sidestepping it there. Another way to answer that question is that the Medicaid base rate of $13.74 is what will be used for these payments to parents. So if it is coming out of a traditional personal care budget that is standalone from any type of home and community-based waiver, then it will be at $13.74.
Great.
What about the number of hours? Because that was a piece too.
Sorry?
The number of hours, that was the other part of the question.
Sure. So the number of hours per week is based upon what was previously determined medically necessary upon clinical review.
Okay, but Adam, this is Kirsten Isgro. So we're one of those families that we are not given a weekly allocation. We are just given a chunk of money that then we can determine pay scale and hours. And
Same.
so I'm fine with, us asking for the compensation at the Medicaid rate. That's not the issue, but I don't want to overstep since we aren't allocated weekly hours. And I think that it sounds like there's a number of families that are in that same similar question.
Yeah. And my sense is that those questions are going to be answered by the DALE guidance. I don't think that, so I'm stumbling because I know we want to upload this and we want to make it available for people for future viewing. And so individual identifying information is tricky in this context. And we're all kind of sorting out this new terrain as we go here. So maybe there's an opportunity. I'm not looking to take this offline and restrict other people hearing this conversation, but we'll have to consider like any type of identifying information here. But if it's truly a children's personal care allocation, then the hours per week is based upon the number determined medically necessary at that base rate. If those personal care funds have been used to fund a home and community-based waiver and unified services plan, then the option for what you can do during this pandemic is gonna be issued by DALE again, hopefully later today, and if not, very early next week.
Okay.
Great. I wanna keep moving because I recognize we have about 8 or 9 minutes left. I just wanted to share that Vermont Legal Aid has a very good website on the special COVID unemployment compensation. Your caregivers who can't work for you right now should be eligible.
Yeah.
And the website is in her comment. Adam will have his email address and the email addresses of his
I'm
colleague.
gonna put it up right now.
Let's put it up right now.
Oh, I want to do it to everybody though. I also saw questions expressing, concern and a desire to be really sure that everybody is notified of this. And so, again, beyond this meeting and what's going to be posted online, ARIS is going to be including our guidance document and invoices in their mailers to families already connected with them. So there's going to be a few different ways this gets out there.
Okay, and I'm just scrolling back up here because I want to ensure that we get to everybody's question as much as possible. There's a question around, are there any plans to expand this to some type of permanent plan where a parent can be reimbursed for having to miss work to care for their children? By the way, my child is an adult now.
So I'm not aware of any plans to expand this beyond the circumstances that are universal right now that with the pandemic. And I'll just say that it's a federal CMS Medicaid rule that prohibits parents and some family members from being paid for this type of personal care.
There is one question around when, with the start date of March 15th, folks are asking, what is the first pay period through March 28th?
The first pay period. So one of the links in our guidance document is to the ERIS calendar. So that'll be available. But when families send in forms, as soon as they're completed, going back to forms can be filled out, including dates going back to March 15th. And the first check cut would be a lump sum for everything up until that point. And then going forward, you'd be able to submit, for every 2 weeks, based upon the weekly max.
All right, we have another question. I'm just going to reiterate. Somebody was asking, can we provide clarification on how this information is getting out to families who don't have access to computers and or whose English who is not their first language? And Adam addressed that at the beginning of the the question and answer period, that we do have a communications team that is working on this. Adam, did you want to add any more?
I mean, I don't think I have anything concrete to add beyond that. Yeah. That documents will be translatable, will be translated as needed. ERIS has access to phone interpretation if people call, and we don't want to restrict this just to people who have a computer. I mean, that's never been the point. So things will be put in writing and sent in the mail as well.
I want to just share a couple affirmations. Yay, Betty! I love Betty Morse. Thank you so much for instituting this. It's so helpful to my family. Great job. All right, another question. Can a parent who is now on FMLA receiving partial pay for regular employment also do this?
So this really shouldn't impact what benefits and supports people are accessing due to changes in their employment or limitations due to their own health needs. This should really be separate from that. I think of the model in place in the adult services world where a shared living provider it's a tax-free stipend, and those folks can work, and that income is not taxable. And so this will follow that model more so. And I see there was an SSI question that was skipped, and we tried to put a pin in it that some other benefits we want to understand more if this would impact it, but certainly families that want to explore things with any benefits counselors in the meantime are encouraged to do so. Essentially, like in a version 2 of our guidance document, we'll try and name some specific resources there for families with questions around SSI and whatnot. So I understand I'm not giving you an answer, but if we're skipping it right now, it's just in the short term.
Okay. Is there an expiration date for this program?
Not right now. It goes back to March 15th, and it is in place for the foreseeable future. It does follow the federal government's determination of when the public health emergency will be over.
And folks are wondering how they're going to get information from Dale.
How those families will, or us. I think we'll kind of get it the same way that you get it, I suspect. So, when we loop back to them, and I saw Tammy mention earlier that Dale's already been given a list of questions that were put in the Google Doc for us to answer today. So Dale already has those, but when we loop back to them with more about, any other questions you collected here, we'll make sure that the process for notification questions that you're raising right now are reflected as well. And yep, I see our page doesn't have it. I think I said that the documents would be up today on our page. The documents on the heirs page are already there. And we'll make sure that includes the invoice on the heirs page. That's there. Tammy, thank you for chiming in. I'll pass it along that the town hall meeting is desirable for Dale.
Great.
Okay, sorry, I stole your thunder, Charlotte. Please keep telling me.
Oh my gosh, no. Thank you. And folks, I again want to say thank you to all of you for being part of, building this arc as we set sail. And Jamie, I'm wondering if you're able to put up the part of the slideshow that has Adam's email address and all the other email addresses. And again, I'm hearing, as Adam said, I'm seeing that this forum was helpful for folks. We will certainly pass that along so that everybody has a chance to be heard and to get their questions answered.
We can keep. Oh, good. There it is. Oh, can anyone hear it? Can anyone hear the child emergency happening behind my door here?
Okay.
Will there be follow-up for those questions? So we are going to put a guidance document that lays this process out in a bit more detail on our website. Families that I've had contact with already, I've got an email list running. Families connected with the Children with Special Health Needs social worker, those email addresses are already collected in a distro list. And then beyond the hard copy mailings that will go out of those documents from ERIS, we're going to engage with our designated agency personal care assessors and ask that they can help disseminate this information to families connected with those agencies as well. So we're trying to use like every avenue possible, including just a direct mailer. What else we got here?
This is Hannah from Brattleboro. Can I share the Facebook page if people are on Facebook, it's a great way to receive maybe unofficial updates, but also share information. And Tammy Carroll had created a Facebook page. If you want to look for it, it's called State of Emergency Order for Caregivers, and it's a private group, so you'll have to request membership. But also a Vermont Family Network Facebook page, and there is a Vermont special needs parents group also. Happy to pass any of those along.
Thank you, everybody. I just want to ensure that, we thank Vermont Family Network. Thank you so much for hosting and for your partnership throughout this. Thank you, Adam, for, being so ready to answer all of these questions. And again, as Adam has stated, we are absolutely wanting to ensure that, we partner with you as much as possible. So please definitely be in contact with Adam, Jessica, Ann Bronson, your CSHN social worker, and we will get through this together.
Thanks, everyone.
Thank you.
Thank you.
Thank you very, very much.